Welcome to your March 2023 Occupational Therapy Advocacy Updates. I'm Clarice Grote, and I'm founder of Amplify OT and an occupational therapist, so let's dive in. First and foremost, the thing that's the top of everybody's mind, the COVID-19 public health emergency. The White House announced that they intend to end the public health emergency on May 11th of 2023. Well, HHS officially announced that they will be renewing the public health emergency through May 11th, which is most likely indicative that it will officially end on May 11th of 2023. Now, there are already provisions that have begun unraveling, such as the Medicaid provisions where states were not taking people off of the Medicaid rolls during the public health emergency if they were receiving that federal support. However, Congress did pass legislation to require them to do that by the end of April, so your states and your patients may already be feeling those effects as April grows closer. But what does the end of the public health emergency mean for everybody else? Well, it really depends on what waivers you have or have not been using. There are some waivers that will end on the day that the public health emergency ends, things like the ability of OT, PT, and speech therapy to do the OASIS in all cases, even when nursing's on the order. That is a waiver that expires when the public health emergency ends. There are other waivers, however, that extend through the end of the calendar year in which the public health emergency ends, such as the ability to provide general supervision to OTAs and PTAs in private practice. That waiver will not expire until the end of 2023, so looking at January 1st of 2024. There are other waivers like telehealth, so allowing OT, PT, and speech therapy practitioners to bill for telehealth services under Medicare. That provision has been extended by Congress until the end of 2024. So even when the COVID-19 public health emergency ends, that provision will not end. The telehealth expansion is definitely thanks to advocacy by all of our wonderful volunteers, as well as our associations, such as the American Occupational Therapy Association. Next, we have your advocacy updates from the 118th Congress. Now, the 117th Congress ended at the end of December, which means we have a brand new Congress starting in January, so everything started fresh. If you've been watching the news, you notice there was a long debate over the Speaker of the House, which delayed people being assigned to committees. So the 118th Congress is finally getting their act in gear, and we're starting to make some progress. So what does all this mean for the therapies? Well, we had some fantastic legislative wins, especially for occupational therapy at the end of 2022. So I do have an article on that at amplifyot.com. Check for the end of 2022 advocacy updates. We did have some fantastic wins, but we also had some misses where legislation that we had hoped had passed, unfortunately, was not included in that final legislative package. Introducing new legislation does tend to take some time, so we are seeing a little bit of delay in new advocacy initiatives for the new year, but fortunately we do have a couple of different ones, and then we'll see some more coming down the pipe. So let's talk about 2 advocacy initiatives that you can take action on today. First up, we have the SHARE Act, which is states handling access to reciprocity for employment. A mouthful, but much easier to say, the SHARE Act. Now, this one does get a little bit in the weeds, but it mainly has to do with our licensure compact and the ability of states to share information between borders to make it easier for you to utilize that licensure compact when you go to apply in a new state. This bill is another example of why I'm so glad that we have experts at AOTA who are able to understand this information, but basically this comes down to being able for the FBI to share background checks and for states to be able to share those background checks with the Licensure Compact Commission, because many states do require a full federal background check in order to obtain licensure. Now, if anyone has ever moved from state to state or has applied for a license in a new state, you know just how burdensome this process can be, how expensive the different fees can be, and how long the administrative process takes. So this bill would fix a technicality in the law to allow for easier sharing of access of information to hopefully expedite that ability for you to get your new license. This also maintains the ability for states to protect the patients in their area by making sure that they aren't giving licenses out to people who don't deserve them. The best part is that this legislation also impacts many other professionals, so just another example of occupational therapy identifying an issue in the world and working to fix it. The second thing that you can take action on today is asking Congress to fully fund the Allied Health Workforce Diversity Program. Now, if you remember, at the end of 2022, we were able to successfully pass an over 5-year advocacy effort of the Allied Health Workforce Diversity Bill. This bill created the program that is administered by HRSA, which provides grants to support and recruit people from diverse and underrepresented backgrounds into the allied health professions. So now what we need is Congress to fully fund that program so HRSA can start administering grants to your programs. This is just a short list of all the different things that are going on right now that are impacting your practice and your patients. For more information and continuous updates, head to amplifyot.com, go to our blogs page, and look at the advocacy and policy resources that are updated for you every single month that are tabbed right there at the front to make it easy to find. All right, thank you so much for listening. Again, I'm Clarice Grote from Amplify OT. I'm an occupational therapist and Medicare specialist and host of the Amplify OT podcast, and I will see you in our next update.